Oh, well, long break.
Yeah, we can do that.
Welcome back, everyone. It is 1:05. And we are pivoting to H 577, where we've made some additional changes. We have some testimony from the treasurer. So if you want to go ahead, Jen.
Great. Good afternoon, Jen Carby from the Office of Legislative Counsel. I'm going to put up a new draft. This is draft 2.1. Unlike most other times, I've actually left the yellow highlighting in and then added green highlighting for new stuff because we went through it pretty quickly, I think, the other day. And so I wanted to make sure we were focusing on kind of everything that has changed from the bill as introduced. So it still creates the prescription drug discount card program. We still have the new language in here saying that the amount paid for a prescription drug after application of the card by an individual covered by a health insurance plan shall be attributed toward their deductible and out-of-pocket responsibilities in accordance with provisions that get amended in sections 2 and 3. And then keeping the addition in the report about the balance in the Vermont Prescription Drug Discount Card Program Fund. And we still have the fund, no changes there. And then section 2, first of the 2 sections where we were making some changes. This is in the insurance statutes on the filling of prescriptions and what a health insurer or pharmacy benefit manager, PBM, must permit for a participating network pharmacy, and also what they must not do. There's a list of things they must not do. One of them is exclude any amount paid by or on behalf of a covered individual, including any third-party payment, financial assistance, discount, adding in discount card, coupon, or other reduction, regardless of whether the individual purchased the drug with or without using coverage for the drug under any health insurance plan. And then, so that's sort of that cost accumulator piece that can't exclude any amount. We're just beefing up the language a little bit around the discount card, and also clarifying that it's with or without, which was implied, but now is more explicit, with or without using their coverage. So that gets counted toward their out-of-pocket limits for prescription drug costs, their deductible, and their out-of-pocket maximums. The rest of that language is the same until we get down here, and we again had looked at this, I think, last week, but this is still the yellow part. So this is what the insurer and PBM are directed to do in order to facilitate the appropriate attribution of the amounts paid by or on behalf of the covered individual for someone who purchases the drug without using the coverage available to them under their health insurance plan. The health insurer or PBM or both must make readily available on their website a downloadable proof of payment form for the covered individual to use to submit proof of the actual amount they paid, and provide notice to all covered individuals at least annually that they are responsible for providing proof of payment using the downloadable proof of payment form or another mechanism if the insurer or PBM chooses to make another mechanism available as well, in order to have their spending properly attributed to their out-of-pocket limits, deductible, and out-of-pocket maximums. Now we get to some of the new stuff. So section 3, still a section that was in the last version of the bill. But now we are playing around a little bit with the language here on what is the maximum amount that a PBM can require a covered person purchasing a covered prescription drug to pay. Because this is where I thought there was some confusion about whether if you used the discount card and that lowered the price, whether that created a max for the PBM if you chose to use your plan, because you would have the availability of the plan you get with the discount card. So now this would say, PBM shall not require a covered person purchasing a covered prescription drug to pay an amount greater than the lesser of the cost sharing amount under the terms of the health benefit plan. And we've just struck the reference to subdivision 2 because that gets a little bit more complicated. It's about what gets attributed to the deductible and out of pocket, and it sort of confuses the issue here. So they're not more than lesser of their cost sharing amount, the maximum allowable amount cost for the drug, or the amount the covered person would pay for the drug if the covered person were to pay the pharmacy's usual and customary cash price after application of any known discounts instead of using the drug benefit, provided, however, that as used in this subdivision C, the term discount does not include a prescription drug discount card or other third-party prescription drug benefit program. Basically, if you're not running it through your insurance, then then this piece about the lowest possible cost you could get does not apply to what the PBM can charge. Does that make sense?
But it does still apply if you were just paying the cash price.
Yes, right.
Okay.
Um,
Which was the original intent of that section.
Right, and so a couple of pieces became clear that some of the various parties and I were all having different reads on what the cash price meant and whether a discount included a discount card. And so given all of that lack of clarity, I thought it was clearest to just say what you want to include and exclude what you don't want to include.
And can I add in here that we heard testimony from Department of Financial Regulation over concerns, and he indicated that he was working with our legislative counsel, and this is the language that came out of it, and that there was consensus on.
Yes, I have worked with DFR, the Office of the Healthcare Advocate, and the Treasurer's Office.
Okay.
So anybody else has not been part of that conversation.
Yes.
But that is who was involved in this, and we sent.
But their concerns
versions
were
around.
addressed.
I believe their concerns were addressed. Yes, and DFR thought cash price and discount were clear enough to work the way they thought they were working, and I thought that the plain language suggested otherwise, so we should fix the language.
For doing that.
So then we did not include this language about the cash price that had been originally proposed by the Healthcare Advocate's Office. We have worked these concepts in with the exception that it's not affecting what the PBM can charge. But this language is now not necessary. And then in subdivision 2, we're just taking the potentially confusing reference to subdivision 1 out. So now it requires the PBM to attribute any amount paid by or on behalf of a covered person, including, and then it's the same list as in the previous section about health insurers and PBMs, including any third-party payment, financial assistance, discount card, coupon, or other reduction in out-of-pocket expenses made by or on behalf of a covered person for prescription drugs, regardless of whether the individual purchased the drug with or without using coverage for the drug under any health benefit plan. I'm actually noticing they should probably say person because everything else in this section is about a person, even though I like it. And I think, and then, it's the same language here about in order to facilitate attribution, blah, blah, blah. It's the same language, except it's just for PBMs. And then I think we're good. Yes, and that is the, so I'm going to change person.
Right. Any questions?
Got all of the highlighting. but then-
Do you need to do like a whole nother version?
I just need to do a clean, I'm just going to do a clean version with person
Okay.
instead of individual there, and I'll do that while you're here.
Okay. Any questions for Jen on the language? Great, thank you.
We take it off the.
Oh, I will take it down. Yep.
Okay.
Thank you.
Oh, wait, it's Jen to take the language down.
Oh.
We can see you. There we go. Welcome,
Oh,
Treasurer.
we could hear you over it while she's live and changing.
That would be more interesting than listening to me. Well,
Coming in today.
yeah, of course. Yeah. Good afternoon, everybody. Thanks for having me. Mike Pichak, Vermont State Treasurer. Just really want to just hit on a couple of high points. And first is just a point of thanks for the committee for working so hard and spending so much time on this bill, and also to the committee and the stakeholders for making the bill better. Also, I think it came in as a good idea with some things that were going to be complicated or some things that consumers were going to have to navigate. And now you've made it so that those things are eliminated, and they'll get the benefit of not just a discount card, but the benefit of it counting toward their deductible if they're using it in that fashion. And I think that's a great enhancement and improvement. So appreciate the committee, appreciate Jen for working on that language with all those stakeholders. I know it was very technical and very detailed and something that had changed a long time ago. And when those things happen, sometimes it can be challenging to find a consensus of what the task was and how to move forward. So we provided also just a short overview of the bill and some highlights and impact that it would have here in Vermont and to each of your districts in a generic way. But just to emphasize that even in Vermont, if we hit the same number of consumers that are in Connecticut taking advantage of the discount card, which is about 1% of their population, I think we have reasons to suggest will be higher than that, but even at 1%, the annual discounted savings would be about $18 million across the board for Vermonters. So really significant savings that would go toward anything that those Vermonters want to spend their money on. But I'm presuming it's going to end up being household expenses given the state of our economy rather than going to pharmaceutical companies. So really appreciate that. And I hope we get that number much higher than 1%. We'll do our best to do that. But also having that appropriation in the bill of 50,000, I think will help us get off and running in a way that Connecticut did not have that opportunity and that advantage. So wanted to highlight that. And again, the impact I think will be significant without a big price tag. Operationally, this is not a burden for our office. We're looking forward to getting it up and running and doing the outreach and getting it successful if the committee sees fit to pass it in the House and the Senate.
Any questions?
No. Can't believe that, didn't you? No, I guess I just, when this passes, all right, you get your $50,000. Can you give me the steps before everybody has a card?
Yeah, for sure. So first of all, we'd want to enter into the relationship with ArrayRx, not about the discount card, but actually the collaboration. And we have conversations about how fast that would be. And from their end, it'll be very quick. From our end, obviously, we have to go through the contracting process, which sometimes can be very quick, sometimes can be a couple of months. But once we're officially in the program and we know when Vermonters can go on their phone and mail in and get their card and download their card, then we'll have a plan to announce it, to have earned media alongside of that, meaning we'll have partnerships, we'll do local outreach throughout Vermont, and also the earned media of whether it be a TV or Facebook, a digital ad, or other ads to get the word out as well. So really a push. And if everything comes together, and we're able to get that contracting process done in an efficient way, the hope would be that you do it before the end of the year, well before the holidays, so you can sort of capture people's attention and get people signed up before the end of the year.
I live on a border town. We get prescriptions in New Hampshire. How's that gonna work?
Yeah, no, it's a great question. I grew up in Brattleboro, so I mean, we are always dealing with these issues. And I think there's two benefits. I mean, folks that are in New Hampshire or in Massachusetts or in New York that are coming into Vermont, if they have a Vermont connection and they have that Vermont address, they work for an employer in Vermont, that's open to them as a possibility to download the card and use it and benefit our retail pharmacies and benefit our pharmacies overall. If you happen to live in Vermont and get your pharmaceuticals out of the state because you don't have a pharmacy locally, there are a lot of pharmacies, because it's a national program and there are national chains that already accept the ArrayRx, even not just in Vermont. So I can't speak to every pharmacy that might be on the New Hampshire border, but with 65,000 plus pharmacies, there's a good chance that they already accept this ArrayRx card. It's just that you can't have the opportunity to download it because we don't have it available to us in Vermont. So I think it can benefit both sides of the border in that sense.
Great. Any other questions? All right. With that, Jen, do we have a new version number?
Yes.
2.2.
What?
Oh, you have a question?
I was thinking, sorry, at this 18 million and just wondering what how much we actually spend in Vermont.
Yeah,
We know that and how that impact and how it will grow.
I think we can make estimates because
That might be helpful for a floor report.
Yeah. because there are different pools of ways that these get purchased, but we'll have better data. Once we have the uptake from the cards, we'll have the use of ourselves. It's not data that we would sell or provide, but you get to see who's using what in terms of a generic way, and might be able to make better decisions on what drugs should be covered under Medicaid or elsewhere. So I think it'll come with better data, but I think we can make an estimate.
Yeah.
And let's not forget, we just heard from Green Mountain Care Board, and there is data in there about how much Vermonters spend on generics, name brand drugs in Vermont.
That would be very helpful, useful, I think.
Maybe our reporter, whoever our reporter may be, will keep that in mind.
Yes.
All right. With that, I would entertain a motion, that we adopt H577 draft 2.2.
Oh. So moved.
I guess we don't need a second.
I'll second.
We don't need it though.
We don't. And yet we always ask.
Well, then I'll third. Anyone want a fourth?
With the motion on the table, the clerk will commence to call the roll.
Brian Chena,
Yes.
Wendy Critchlow,
Yes.
Alan Demar,
Yes.
Leslie Goldman,
Yes.
Lori Hope,
Yes.
Erin Leaders.
Yes.
Deborah Powers, yes. Valerie Taylor. Daisy Rebecca,
Yes.
Francis McFawn.
Yes.
Chair Black.
Yes.
So 11-0-0.
And I have asked Representative Critchlow to report this bill.
You did.
And is,
And
it's it.
favorable with amendment. We didn't do a strike call, did we? Oh, so.
It's draft 2.2 though.
Okay, so this is a
Yeah.
strike call.
Right?
So this has to make a couple stops along the way. It's got to go to both appropriations and Ways and Means, so probably won't be on the floor for a time. Yes, and we'll watch it through those committees, and thank you very much.
I'll give it to you.
Thank you, everyone. So we actually, nice job. We actually don't have testimony until 2:00. So we can